Hi, this is Team Phoenix. We are a team of two. My name is Aruna Maurya and my teammate is Srividya. A little about us. I am a computer science graduate working as a software development engineer at Philips. Srividya is a research scholar in the Department of Management Studies at IIT Madras with a work experience of 10 plus years in health tech and other roles. Before we dive into the problem, I'd like to shed some light on two terms that are going to come up in the presentation quite often. The first one is NCD, or more commonly known as non communicable diseases, is a blanket term used to refer to diseases like diabetes, cancer, neurological diseases like paralysis, multiple sclerosis, etc. The second term is a rather uncommon idea. Post treatment care refers to a care plan given to a patient after their major treatment is over to ensure a complete and healthy recovery. Now, when we look at the stats of India for the year 2016, we see that one in every four Indians die of NCDs, which account for about 63% of all deaths. This figure is quite an eye opener, and we asked ourselves, where did we go wrong? Among the many reasons that came up, we narrowed down to one, that is, healthcare in India is overburdened primarily because A. Lack of preventive healthcare systems, and B. The massive inflow of relapse cases in hospitals. Having identified the cause, we thought to ourselves, what if there was a system that could provide personalized post treatment care plans to patients to ensure a complete healthy recovery? And Phoenix does just that. Phoenix is a digital platform that connects users to a team of doctors who not only design a custom healthcare plan but also allow continuous monitoring and enables patient to patient interaction. Let's have a glance at a detailed workflow of Phoenix. When a user enrolls him or herself in the Phoenix program, they are met with a consultant doctor who is responsible for mapping a team of doctors by analyzing the patient's medical history obtained from their PHR. The team of doctors for a patient who has had a heart surgery might include a dietitian, a specialist doctor, and a psychiatrist. This team would differ as per need basis of the patient. The team is responsible for designing a complete care plan for the patient and making sure that he or she has a complete and healthy recovery. Let's now watch a user story to outline how Phoenix would benefit a patient. Mrs. Radha is a 60-year-old woman and lives alone in a small town of Palampur. She has recently undergone an angioplasty operation to restore blood flow in her arteries. She is required to visit the nearby hospital once in 6 months for regular checkups and blood tests. She is scared and anxious of who will take her to the hospital if she were to have a heart attack. As she is waiting for her token to be called, she notices her neighbor Mr. Sharma, who is also a heart patient, busy doing something on the phone. She becomes curious and asks him. He responds by saying that he is updating his Phoenix tracker. He further explains that his doctor had suggested he get in touch with the Phoenix team to get a care plan. Seeing her confused, Mr. Sharma talks about how, through this plan, he gets the benefits of consulting doctors across allied healthcare systems like allopathy, homeopathy, etc. Mrs. Radha is still a little unconvinced as to why would it make sense to enroll for this kind of a service. Mr. Sharma senses her worries and shares that the best part is that this plan is personalized based on his medical history. He tells her how he used to be always worried and anxious, but now he feels in control and happy. How Phoenix would touch lives of users and make their quality of life better. Having said that, it is only fair to ask, what is it that makes Phoenix unique? Well, for starters, it provides personalized post treatment care plans based on a user's medical history. It allows the users to choose from the various allied healthcare services like Ayurveda, homeopathy, etc., that too all at one place. It removes the hassles of a user having to manage three different accounts on three different platforms to keep a check on his vitals. Now, let's get into the business side of things. Our customer base would include patients, hospitals, and insurance buyers. While patients would be our direct target, types with hospitals would ensure reduced inflow of relapse cases. Similarly, insurance firms would also be interested in reducing their payouts and hence would broaden our customer base by encouraging them to adopt this plan. Hospitals would also prove to be an important point of contact for awareness and reaching out to potential new customers. Medical covers through corporate firm is another method to ensure that people are aware of the platform that offers them these services for their loved ones. Phoenix would also provide, among other features, a free membership and premium insights into the data shared by users with their consent. Having said that, building Phoenix is going to come up with its own set of highs and lows. While Phoenix would tap into the unexplored ecosystem of allied healthcare and act as a bridge to connect caregivers with patients, data security and compliance would still be a roadblock that would need to be deliberated upon. There also have to be systems in place for the validation of doctors and medical staff from Ayush. Building Phoenix is not going to be easy, but it definitely is worth a shot given the problems it might solve. Thank you.